Welcome, my name is Mr. Patel. I'm one of the educational supervisors at East Kent Hospitals University Foundation Trust, working in the eye department. We have all the major 7 subspecialties of the eye covered within the department. East Kent Foundation Hospitals has 3 main acute sites. The eye department is located at all 3 sites, and it does have some peripheral community outreach clinics which the trainees are not expected to attend. At the moment, the timetables are set out so that trainees rotate 6 months at William Harvey and alternating with 6 months at Kent and Canterbury. There is a variety of experiences at 2 different sites. For example, at William Harvey they will learn to manage vitreoretinal patients, and they'll have an opportunity to see vitreoretinal surgery and assist in that speciality. Whereas in Canterbury they will have experience in medical retina and will spend time having cataract surgery experience there, as we have a dedicated ophthalmic suite. Both trainees that rotate will get experience in cataract surgery at both sites. However, at Canterbury there is a little bit more surgery because of the way that the setup is within the ophthalmic suite. So we do expect that the trainees will have equivalent numbers at the end of the training.
I'm Han Bin, I'm one of the registrars. I'm ST3. The vitreoretinal firm, you get really good hands-on experience because you do 3 vitreoretinal clinics where you're basically supernumerary. So you don't have your own booked list, but you can discuss all your patients with the consultants, where you actually learn a lot more, and you also have the opportunity to spend a full list in theatre where you can actually get some hands-on vitrectomy experience, which unless you're a fellow in that specialty you don't tend to get in other hospitals. So from that aspect it's really good. In terms of the medical retina side, there's a breadth of knowledge from different consultants here, specialising in uveitis, AMD, as well as other aspects of medical retina. And during both rotations you have a cataract list and also a subspecialty list. So when you're doing your vitreoretina you get 1 cataract list and 1 retinal surgery list. And when you're doing your medical retina firm you actually get 2 cataract lists and an additional alternate week complex cataract list as well.
For GP trainees and Foundation Year 2 trainees, the rotation works slightly differently because they are on a 4-month cycle. We have a comprehensive training program for them, and Mr. Mike Mortar, one of our primary care consultants who we've recently appointed, is expected to take charge of these 2 trainee groups. They will be located in William Harvey to get experience in eye emergency medicine, and there will be opportunities for them to attend surgical sessions, but it's something that they would have to inquire depending on the timetable set out for them. They are expected to attend formal teaching sessions both for the foundation school but also for the eye department and for GP trainees as well. So there's quite a lot of educational emphasis for foundation trainees and GP trainees, as they're not yet specialists. So they will have the ability to attend more teaching sessions that will give them the foundation that they need to move on to more specialist fields.
Our on-call is 1 in 6 on-call system. So your on-call starts after your normal day. So for example, you do your normal day from, I don't know, 8:30 to 5, and then your on-call starts at 5 p.m. and then you're on call overnight till the next morning at 9 a.m. and then you go back to your usual work. The workload really varies depending on day to day. Sometimes you will see 5-6 patients, some nights you won't see anyone. If from the on-call, if you have any patients you need to hand over, or patients who are not urgent overnight who needs to be seen in clinic, those need to be added onto care flow or handed over to the doctors who will be on rotary ward the next morning. The weekend on-calls start at 9 a.m. and they finish on Monday morning at 9 a.m. The handover process usually happens from the afternoon clinic to the evening on-call on CareFlow, which is an electronic system that we use, which is very simple to use. It's the same login as your computer login for the trust, and also a courtesy phone call to hand over patients. You don't have a booked clinic to say for your weekend on-calls, but you can arrange between the doctor who's on call the night before in advance to see your patients at a certain time. The good thing about the on-call system here is you can see all your patients on rotary ward, which is the ophthalmology and the ENT ward, and there are receptionists normally during daytime between 9 and 4 or 5. So they can check the patients in for you, do the paperwork, so you're there really to see the patients. So it all works very well.
Teaching sessions are run on a Friday afternoon, and our department has now in total 15 consultants, each with a subspecialist interest. And on a weekly session, these teaching sessions are supervised by a consultant and trainee. So we have the registrars who will organize the training sessions and involve the foundation trainee and the GP trainee. And we will select a variety of different formats: case reports, journal clubs, videos of surgery to look through. And at some stage, we will probably have external speakers as well to come and give talks. This runs pretty much throughout the year, weekly sessions for formal teaching.
We have a scheduled teaching, which is every Friday. That's normally organised by the registrar, so at the moment I organise the weekly teaching. The attendance can be quite variable, and we have different consultants teaching every week and different middle grades presenting every week, and also an F2 or a GP presenting the ward patients each week. So there'll normally be three speakers in each session. Starts at 2 p.m. and finishes around 4. And that goes alongside the regional teaching that's organised by the deanery. In terms of other teaching, there's obviously plenty of teaching in clinics and in theatre.
As far as informal teaching, depending on which clinics and theatres trainees are assigned, there will be opportunities to learn different aspects, particularly with retina, which is one of our strengths. We have 9 retina consultants in total, both medical and surgical, and we expect trainees to get experience in how to read OCTs and read angiograms, as well as managing retinal cases that they encounter. So we hopefully will provide a very comprehensive strategy to ensure that when trainees leave, they're comfortable with managing patients with retinal pathology. You'll have also the opportunity to gain experience in research and clinical trials, which is one of the mandates of the KSS Deanery. The eye department is very good at delivering both commercial and NIHR portfolio studies. And one of the recommendations as part of mandatory training is to have GCP training, which we expect all trainees to have on arrival, and we will then allocate you projects which you'll be assigned to, so that when you leave you have experience of how clinical trials are run within a department, and at some stage you might be interested in developing a research interest later on, and that can be recorded in your ARCP portfolio.
If you've done a project which is publishable, you have the opportunity to write it up, and the department will basically support you, and you can be sponsored as well in publishing the article. There are lots of options anyway with different journals, but it is down to you whether you publish it or not. But you're certainly given a lot of opportunities to do that. The on-call rota for the registrars and the middle grades are done by one of the staff grade doctors. You get your usually 6 months rota in advance. If you need to do any swaps, you just ask the doctor who you want to swap with, and you just have to inform the manager of the department, the doctor you're swapping with, as well as the switchboard with all the details, and you just email them. It's relatively straightforward to do. If you need to book any leave, that goes through the managers again. You have to give 8 weeks notice for any study or annual leave. And and you just have to sign the form and hand it in advance. I think it's worth bearing in mind that you will be doing quite a bit of travelling in your medical retina rotation. So you would be doing a morning theatre session or morning clinic in William Harvey and drive over lunchtime, and then do your afternoon session in Canterbury and drive back for the on-call. So you have to be prepared for the travelling. But in my view, overall, the good supervision and the opportunity, I think, for theatres operating makes up for the fact that you're travelling during the day.
As a large district hospital that covers around 3/4 million patients, the service requirements are intense, but that's no exception to any other part of the region. We do feel that things sometimes can get busy, but we equally ensure that the registrar's timetable and clinic template is fixed at a certain set number, approximately 12 patients per clinic. That gives the trainees sufficient time to work up a patient and discuss with their consultants, and perhaps have the opportunity to do case-based discussions, case exercises, which they can reflect on and then submit as part of their educational portfolio.
It's a very friendly unit where there's a lot of support and a lot of opportunity for each trainee to address what their needs are. So if you are short of cataract surgery and that's where you really want to improve, which is what I really wanted to do, if you want to focus on doing lots of vitreoretinal things, then you can do that as well. The unit is very open to taking trainees' suggestions and their needs and tailoring your program to that. All the consultants are really approachable, all the nurses and staff are very nice. And it's a unit where you will really get out what you'll put in. So yeah, it's a really good place to come. It's been very enjoyable. It's a very friendly unit, very approachable. Consultants and supervisors, they're always very keen to help. And there's a lot of opportunity for surgery if you're keen.
We'd like to welcome you to our department, and we look forward to working with you. No doubt you'll have a lot of experience, you'll meet a lot of new faces and new consultants. There are some very innovative ways in which we work. We have access to all the latest technology in terms of healthcare, and as the trust is very IT friendly, we're working with all different departments to make this nice and easy for you. We look forward to working with you, and we hope that you can recommend trainees to our hospital to get all the retina experience, surgical experience and research experience for the future. Thank you very much.